Well, Janella, the legacy of COVID-19 in this country could very well be the failure to protect vulnerable seniors. Of the 700 deaths in Canada, roughly half are elderly residents in long-term care. The deaths were predictable. There was ample warning from Italy and Spain. In Ontario, there have been at least 119 deaths. Each one is more than a number. They were loved.
Hey, how are you? I'm really glad to see you today.
I'm glad to see you, honey. Always am.
City News first introduced you to Kim Beauchesne and her 94-year-old father, Ken Flanagan, a month ago. Because of COVID-19 restrictions, Kim couldn't go inside his nursing home. So she talked to him on the phone for up to 5 hours every day outside his window.
How could I go without seeing you every day?
Ken died on Thursday, just 4 days after being diagnosed.
He was a bit panicked. He didn't know the people that were coming in and out.
Kim's sister was the last to see him.
And he was yelling for her to come in. You know, why won't you come in? I want you to come in here. And then he started to cry.
Kim's father's long-term care home, Chartwell Ballycliffe in Ajax, has had 25 positive cases and 4 deaths.
They are sitting ducks. It's like an invisible wolf in a hen house.
How long-term care homes operate is a major contributing factor to why it has been spreading so rapidly inside them. Workers are given part-time hours, no benefits and low pay, forcing them to work in multiple homes to make a living. And the spread has been nothing short of heartbreaking. In a Bob Cajun home, 29 out of 65 dead. 22 dead at Seven Oaks in Scarborough. And in Dorval, Quebec, at least 5 out of 31 deceased residents were COVID-19 positive. A criminal investigation is underway. Advocates say they've been sounding the alarm, but no one was listening.
It's a stain on our country. And, you know, we hear about people caring about seniors, but that care doesn't translate into public policy or dollars. But we've been predicting this for months on end.
In Ontario, the Chief Medical Officer of Health has recommended long-term care homes only allow staff to work in one home. But BC and Alberta have taken it further and made that the law.
Should you reorganize the whole system, make it law so that they can only be in one long-term care home? It's pretty obvious, and don't you think this should have been easy to recognize from the get-go that this is how it would be spreading in long-term care homes?
I'm going to rely on our health team to come up with that recommendation, but it sounds like common sense. You don't want people going from home to home to home, but on the making sure that we top them up on the wages. There is a program right now with the feds that we're looking at.
Kim doesn't blame the workers. She's happy her father didn't suffer for too long.
He is kind of grateful because he would have had a lot more struggling to go.
9, 8, 7.
Kim has been very worried about the health of the long-term care workers. We know there have been outbreaks in at least 89 homes, with 430 staff members falling ill.